For patients with severe hip osteoarthritis, total hip replacement is routinely recommended, but data are lacking on the procedure's effectiveness as compared with that of non-surgical treatments. A new trial compared outcomes after total hip replacement with outcomes after resistance training in this patient population. In this multicenter unblinded randomized trial, 109 adults 50 years of age or older with severe hip osteoarthritis and an indication for surgery were assigned to undergo total hip replacement or to receive individual supervised resistance training with a physiotherapist twice weekly for 12 weeks. The primary outcome was the change from baseline to 6 months in patient-reported hip pain and function, as measured by the Oxford Hip Score. Scores range from 0 to 48, with higher scores indicating less pain and better function. Overall, the mean Oxford Hip Score improved significantly more in the hip surgery group than in the resistance training group, improving by a mean of 15.9 points as compared with 4.5 points. Similar numbers of serious adverse events occurred in each group, with the majority of events occurring after total hip replacement. The authors conclude that in patients 50 years of age or older with severe hip osteoarthritis and an indication for surgery, total hip replacement resulted in significant improvements in patient-reported hip pain and function at 6 months as compared with resistance training. Full trial results are available at NEJM.org.